and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from the Moses Lake Professional Pharmacies podcast studio, and super excited to have Dr. Richard Edgerly back on our podcast. He's been on our show at least once, but we've done many different events with him, and we just love having him on. He is a wealth of knowledge about not just medicine, because he's an amazing wealth of knowledge there, and a great doctor, but also just about the American spirit and freedom in general. That's one thing I love hanging out with Dr. Edgerly about, is we really both are big believers in individual liberty, and that's what America was founded on. So Dr. Edgerly, welcome to our show.
Hey, thank you.
So tell us, today we're going to be focusing a little bit on your practice, which is Assurance Health and Counseling in Yakima, Washington. And I love giving the example of it, because you haven't billed insurance for over 10 years. Is it 10 years? 10
we
years
just
now?
Started our 12th year now.
12th year. Wow, that's amazing. So, and 12 years ago, as a doctor going out of the insurance market and saying, well, I'm going to open up a practice where I don't bill any insurance, that was a crazy thing. Yet today it's not as crazy, because you were kind of a pioneer in that field. But tell us a little bit about that history and why you left insurance medicine.
All right. Well, I was in the usual system, just like everybody else. You graduate from medical school and you open a clinic. I had a little bit of a background in business administration for physicians, so I was not intimidated to start my own practice. And I was actually hired by one of the hospital groups to help start 3 clinics. And so I was in that process. I was 20 years into it or something like that. The usual, start with hardly any patients. Pretty soon you have too many. And I was seeing, 35 to 40 a day. I had 2 nurses that ran ahead of me that were excellent. And it was very efficient. And then all of a sudden, 2000, and it always got a little bit worse, more and more requirements from Medicare and some of these insurances before you got paid. And it just, once Obamacare started, then everything just collapsed.
Yeah.
And I went from seeing 35 to 40 a day to seeing 25 a day. Instead of being home at 5 o'clock, I was now home at 8 o'clock at night. Never seemingly putting enough information for billing and whatever the hospital group wanted, And then you started getting questioned also from the hospital administration on everything you did. So one of my last patients that I saw there, I was going to operate on his foot, and before I did, the patient said, "Oh, excuse me, what does it matter whether I have a handgun or not?" And I said, "Well, it doesn't. Why are you asking that?" And he said, "Well, your nurse asked me." So I called my nurse in and I said, "Why did you ask him whether he has a handgun or not?" She goes, "Oh, it's one of the new questions on the Obamacare requirement."
Yeah.
And I said, "Well," and of course she's a handgun carrying person anyway. And so I said, "Well, don't ask that again." But then I began to realize that what I had gone into medicine for was now not the priority of anybody else. It was information gathering, and it just got worse and worse. I threw field salvos out. For example, I told the administration at that time, I said, "Well, I'm not going to be board certified anymore." Boy, I had 4 guys at my desk right away, and I was actually going to be board certified, but I just wanted to know where that would go. And then I told them, well, 80% of your people need to be compliant with this. I'm going to be part of the 20%. That didn't go well.
That didn't go well.
So I realized that even though I was getting to be an older guy, I wasn't going to spend the last 15 to 20 years of my medical career being an information gatherer for people that I didn't appreciate or respect.
Yeah.
And so I went on a vacation with my wife down to Arizona, and it could have been the heat. I don't know. But over this 4 or 5 day period, I had this, I'll use the word vision, but it wasn't a vision, but I had this thought of, what if I was to start all over? And I was just going to not have Medicare, Medicaid, insurance, etc. And it was just a membership relationship between me and my patients, where they paid a membership and I took care of them. And at that time, a lot of the employers didn't know what they were going to do either, because they were being forced to provide insurance for everybody,
Right.
or at least some kind of health care. So while I was down there, I actually called several of my friends I went to high school with. They were idiots then, but now they were the corporate guy up in some of the fruit industries, et cetera, right?
Yeah.
Where they had 300 employees, et cetera. And they were all hot on the idea too, Now, that didn't pan out because many of their employees, I think, were probably not from this country.
Yeah.
And therefore, they just wanted to keep their mouth shut rather than admitting they had 300 employees that needed to be covered, et cetera. So everything I planned, by the way, failed because I think God had a better plan. So I thought, we're going to go after businesses. And yet our first 1,500 patients were all private.
Just individuals.
Just individuals.
Yeah.
Individuals who didn't have insurance. We think there's some misnomers in the world. The world's overpopulated. Well, not really. Everybody in the world can fit into like New Jersey here,
right,
with a square, with a football field size, property or something like that. One of the misnomers is everybody has insurance, and they don't. And if they do have insurance, I don't know what the percentage is, but if they do have insurance, they have this deductible of $5,000
at minimum now.
Minimum.
I mean, $5,000 is nothing anymore.
And they have copays.
Yeah.
And so really they don't have the access that everybody thinks they do, because you see a mole on your skin and you go, boy, I wonder if that's cancer, but gee, is it worth $40 copay and then an $180 office visit?
Yeah.
And so they don't get those things looked at. Well, what happened is I went from having 3,500 patients to about 100. And it just slowly built and built and built and built. And I changed patients because, again, my practice was based on insurance, Medicare, Medicaid. And now my practice was based on individuals that didn't have any of that. Yeah. And there's a lot of those out there. In fact, I think the majority of the population does not have insurance. Well,
it depends on how you define insurance. Like Janet and I we're uninsured. We don't have insurance because we have a health sharing ministry. I imagine a lot of your patients have a health sharing ministry also. But also, people are underinsured when you say the high deductibles. Yeah. There are many employer-based insurances now. Their deductibles for their employees, their deductibles are like $7,000.
Right.
So, like you say, most employees don't really access it anyway because they're paying out of pocket for most everything anyway. And then that's when it starts getting expensive. So keep going, Dr.
Right.
Edgerly.
So anyway, we opened on January 1st or January 2nd, 2014, what we called Assurance Healthcare and Counseling Center. And I had a son-in-law who was a business major. He was excited about this. We worked on it for a year before we opened. Can this work? Will this work? And about 6 months into it, we had everybody ask us any question you want. Well, what if I don't have any insurance? Perfect. What if I do have insurance? That's all right. We can cover you. What if I have Medicare? We can take care of that, et cetera. And about 6 months into this, a guy goes, oh, I think that's what my mom has in Seattle. Well, we didn't even know what the term direct primary care was. This was just made up in my mind. And found out there was another two doctors, a doctor and his niece, who was also a doctor, Erica Bliss, I think her name was. And they had what was called Q-Liance in Seattle. And they were 2 years ahead of us, which was nice. They had kind of jumped some hurdles that helped us. They actually, I think, went bankrupt because I think they made a agreement to help the government again, which is a big problem. Yeah. And they had borrowed money, I think, to do it. We didn't borrow any money. I took money out of my savings, hired my other daughter-in-law to be our receptionist because she was a receptionist for another company at that time. And we just started. She was there 2 months before I started, just explaining what direct primary care was, how the clinic worked, et cetera. And so when I started, I had about 100 patients. I brought my nurse with me, which was a mistake because she was a AAA personality. Which why we got along so well for 17 years. But I found out when you're seeing 3 or 4 patients a day, to begin with. I didn't need a nurse
Right.
to do the blood pressures or take
Yeah.
the temps. I could have done that myself.
You mean, wait a minute, you're a doctor and you take blood pressures.
I do, actually. And I had to learn once not to put the stethoscope on the chest. It's on the arm.
Oh, yeah.
Because I kept hearing the beat all the
you
way
were
through.
used to doing
Like,
this.
oh, wait,
yeah,
wait.
right.
Felt pretty stupid. The hardest part was giving children immunizations because I had never done that in a long time. I said I would just leave, the room and my nurse would take care of all that. So all of a sudden now I had to draw it up and, do all those things. Lots of funny stories with that one.
Well, we'll get into some of those. But I remember, I think I came into your practice in 2015 or so. So shortly after you opened up, it might have been, I think it was 15. And the coolest thing was, and the most unique thing is that I got to see you right away. You were there. And I saw you were actually checking patients in. You'd come back and say, "Hey, Mrs. Jones, I can see you now."
Yeah.
It's like, is that the doctor? That's the doctor. And there was one receptionist, your daughter-in-law, and it was so accessible, which is what you talk about. And most patients get to see, if they're lucky, they get to see a doctor face to face. I mean, that's lucky now.
Yeah.
So that's
or
one of
they
the coolest
or they
things
see them 3 people later. After the receptionist,
right.
after the medical assistant, after the nurses. It goes on and on.
So you have these patients pay a monthly subscription,
right?
And how accessible are you? Are you available during the day? Are you available on weekends?
Yeah, so we have a membership that provides everything within the 4 walls of our clinic. So if you come in for a physical, that's covered. If you come in because you hurt yourself, that's covered. Do I need to sew you up? That's covered. Do I need to do some cryotherapy to take off a actinic keratosis? That's covered. Do I need to do a little surgery to take out a lipoma or whatever? All that is covered in our membership fee. There's nothing extra. We also do EKGs. We also do pulmonary function tests. Those are all included in the membership.
An EKG is included in the membership.
Right.
So just out of curiosity, to give them an idea of how much these things cost, what would, I imagine you know this, because when we, in the free market medicine space, we know the prices outside and inside insurance-based and non-insurance-based. So what would an EKG outside of your office usually cost at the hospital?
You're right. I do lose track of some of that stuff, though. So it may be a couple $100.
Yeah.
And then you have to also pay for the cardiologist to read it.
Which is another couple hundred at least, right?
Exactly.
Right. So you're talking a $500 bill.
Right. And we have this network also for things that I don't do, for example, like ultrasound. We have an ultrasonographer that comes in. Her fee is typically around $225 for checking the abdominal ultrasound or pelvic ultrasound. And it's a little bit more for cardiac echo, which is fine. It's worth more. But that price also includes the radiology reading. So I read the x-rays in my office, but then I also get an overread for no extra charge. So we charge the patient, the ultrasonographer or the x-rays the same way. It runs about $125 for most x-rays, 2-view chest, 3-view ankle. They charge us and then we charge the patient. We don't add anything to that. We just do that so that they're not begging money from our patients.
Yeah.
So we cover the risk there, although there's virtually no risk. So we have that network for those type of things. We have also a network that just provides MRIs, CT scans, some specialty care.
So MRI is a common one. When we talk about, the average person can't afford to pay cash for an MRI. Give an example of that. MRI in the hospital versus MRI you pay in cash.
Yeah, again, MRI probably in the hospital is going to be over $3,000. And that, again, is going to be a added on charge for the radiologist to read that. Most of our MRIs are all under $500. And again, that includes the read. Now, you may have to travel 30 minutes to get that. But
to save $2,500,
everybody wants to do that. Everybody wants to do that.
And tell me about So a lot of times with an MRI or some of these procedures, when you're going through insurance, it takes months to get prior authorized, correct?
Right.
So for a cash MRI, how soon can somebody be seen?
Within a week.
Yeah.
Yeah. Always within a week.
So all these services you offer, what about 24/7 access? Do they have access to a doctor 24/7?
They do. We are open 8 to 5, Monday through Friday. Well, actually, Fridays we cut back now from 8 to 3, just to give our employees a
Good
break.
for you guys.
So we're open the usual five days a week, 8 hours a day, and then we're on call 24 hours, 7 days a week. So once, if I'm on call this week, which I'm not, I would be on call from 5 o'clock tonight until 8 tomorrow. Now, that sounds scary, but the first 6 years of my practice, I was by myself, and I was on call 24 hours a day, 7 days a week, and I had 22 phone calls after hours.
In 6 years?
In 1 year.
In 1 year. Yeah.
In 1 year. That was it. So that's less than 2 a month.
Yeah.
But when you get people in and see them, then they're not calling at night.
And you train them about what's an emergency.
Right.
And
Right.
Yeah.
You
Exactly.
don't fill meds at night, that type of thing. I think the important part of that too is when you have a direct primary care clinic, your people are typically employed.
Yes.
Well, employed people aren't up at 10 at night doing stupid things.
Or 2 o'clock.
Yeah, that's right.
In the morning.
That's
Yeah,
right.
they're sleeping.
Yeah, they're sleeping because they got to get up, go to work tomorrow.
And we also have a watch. We can say, well, do I really want to bug Dr. Edgerly? I'll wait till 8 o'clock in the morning.
Well, when I had adding physicians and nurse practitioners and PAs on, I told them the 2 rules of being on call are this. 1, I do not want any of my patients going to the ER spending $3,000 when we can do it in our office. So if they call and they cut themselves on a Saturday or Sunday, we go in and sew that up ourselves. It takes me an hour, 20 minutes to get there, 20 minutes to do the work, 20 minutes home. Right? But it saved them $3,000.
And 12 hours.
And 12 hours of waiting. That's exactly right. The second thing is I never want you to go into the office. So if somebody calls and they have all the symptoms of urinary tract infection, for example, or they have something that you think can wait, then they can wait. Or you're free to call a prescription in for them. Okay, that type of thing.
And I mean, it must be.
And it works really well.
To have access like this, 24/7 access to a doctor, it must be really, really expensive. Tell me how much that costs per month.
Again, I lose track of that. We started out at $95 a month, and I think now it varies. I think don't quote me, but you can go on to our website. It's called assurancehealth.org. assurancehealth.org. The company's name is Assurance Healthcare and Counseling Center because we do have professional counseling as well. I think it's $125 a month. For a couple, it's $225 rather than $250. Families are, I'll make up a number, $250, something like that. That's for 1 parent and 5 kids. And it's a little bit more if it's 2 parents and 5 children. And then we have business rates also. So if we're building a business.
Share screen.
Yeah, for 10 people, they're giving us 10 people for 1 check, so to speak. We give them a discount too.
That is almost unbelievable. People think healthcare is so expensive, and what really is expensive is insurance-based healthcare.
Right.
That's what's expensive. This is very, very affordable. I mean, the average person, $200 a month for a couple is basically 2 cell phones. 2 cell phone bills.
Yeah, and we have no one complain about that. In fact, we have most people saying you guys don't charge enough. But our motto from the beginning was and I don't mean to beat anybody up, but I always said, I don't want to work for the guy who owns Pepsi Cola. He lives within a half mile of me. That's why I think I've made that up. But I want to work for the guy who works for Pepsi Cola.
Yeah.
The guy that's out there, middle income or poor, trying to make it day to day with his family.
Yeah.
And I think back, if my dad, I was from a family of 6 kids, but if my dad could have paid the equivalent, which would probably be like $50 back in the early 60s, that would have been unbelievable.
Yeah.
Right.
Right. Exactly. Well,
So that's what it is today.
Yeah. And this is how free markets work. My dad tells a story. So him and his three brothers, and this must have been in Yakima. So when they were little kids, and they were 4 years apart. All four of them were like from the oldest to the youngest, it's 4 years apart, or maybe 5 years. They had tonsillitis. So, and my grandpa was known for being the ultimate negotiator. So he talked to the, I don't know if it was an ENT doctor back then. Did they have ENT doctors back then?
I don't know that they did.
Yeah, right. Maybe just a general
or maybe
surgeon.
just barely.
Yeah, right.
Yeah.
Could have been a family practice guy.
Probably was.
Probably was, actually.
Probably was.
Yeah, it was. Yeah.
I know the guy I worked for when I began as a medical business administrator. He did tonsillectomies. He did appendectomies. He did hernia.
And he was family practice.
Family practice.
Yeah.
Hip replacements.
Wow. Yeah. I know the doctor that delivered me, family practice doctor. He did appendectomies. He did ortho stuff. I mean, in the 60s in Othello.
Yeah.
I mean, somebody had to do it there, right?
That's exactly right.
So anyway, my dad negotiated. My dad's dad, my grandpa, negotiated with the doctor a reduced fee because he was taking care of all four at once.
Yeah.
And it was something like, it was very affordable. And my grandparents didn't have a lot of money, but the point is this was before, most people in the 60s, this would have been the 50s. They didn't really have health insurance.
Yeah.
So
until 70s.
Right. People paid cash for services, and it was a lot more affordable. Insurance is what has made healthcare expensive, and it still does.
Yeah.
Without insurance, healthcare is still very affordable for most things, most non-catastrophic things, and the things that you're describing are mostly non-catastrophic.
Right.
You have a heart attack,
you
have a car wreck. It's something you really can't take care of. They need to go to the hospital. It's going to be expensive, so you need some kind of backup plan. Talk about that with insurance and health sharing ministries.
Yeah. So what we advertise is that if you are a employee of a company that has insurance, for example, just take the highest deductible insurance. So you don't get a $1,000 deductible, get a $10,000 deductible. Because with direct primary care, 95% of your health care doesn't have to be managed at the hospital.
Right.
How many of us have been to the hospital for an appendectomy or for a heart attack?
Yeah.
Or whatever. It's a small percent.
Yeah. Right.
So now most of the people who are not employed by companies that have insurance. I mean, if you drive down Main Street of the town you live in, and you go by the gas station, they don't have insurance.
Right.
You go by the mini mart, they don't have insurance. You go by, we think these people all have insurance, and they don't. So if you don't have insurance, then you buy a membership at our place. If it's something that's going to be more expensive, there are what are called sharing communities. Now, some of them are faith-based. Most of them began to be faith-based, but there's also those that are not faith-based. Now, when I say faith-based, we can take an example called Samaritan Ministries. That's what my wife and I are members of. We pay a small amount, I think it's $341 a month for both of us for major health care. So they don't expect me to send them a bill for, $700 that I paid to have this done or that done. But once it exceeds $750, they cover everything.
Yeah.
And they also help negotiate prices like that. So, for example, my wife and I recently went to the eye doctor, and maybe one of us, maybe both of us needs cataract surgery.
Maybe one of us.
Privacy, I can't say who that is, but it may not be me. Anyway, I called and said, gee, I just want to know, is that covered under my sharing? And they said, yes, it is.
Oh.
Now you have a $750 amount you have to pay yourself, but after that, that's all covered. Well, that's good to know.
Yeah.
It's going to be $6,000 to $10,000 based on which lens you choose, etc. But that's how the ministries work. Now, if they're faith-based, they do have some requirements. They want you to go to church on a regular basis. They expect you not to drink and drive at the same time or use drugs that are illegal, etc. And that's fine. That's my lifestyle.
Yeah.
And most people of faith, it is. But there's also sharing companies, if I can call them that have nothing to do with religion-based. And you can go on our website again, and it has some of those listed. One of them, I think, is called CrowdShare, for example.
That's the newest one that came out.
It's one of the newest.
Yeah, I'm interested to hear what you have to say about it.
Well, so you can go again and see, you can look that up and see how it works. But I have a patient, for example, that's on that. She and her husband own a couple of small businesses, real estate, etc., and they're on CrowdShare. Well, she needs a cholecystectomy. In fact, I think she had it 2 days ago, and they covered that all the way from the beginning.
Yeah, and it's not insurance.
Nope, it's not insurance. It's sharing.
And what this share is basically is you pay a certain amount per month, and it goes into a big pool of money. Really, how insurance was meant to work, but it's not the way it works anymore. That's a whole other animal. And when they take from that, there's very, very small administrative charges, unlike insurance.
Right.
And when something happens, they take from that pool and they share it with the other members of the group. It's beautiful. It works amazingly. My wife and I have had Samaritan Ministries. We started with that, and then they didn't have different tiered plans at the time, so we moved to Christian Healthcare, and we pay $180 a month for both of us. Now, this is what's great about the free market. The government doesn't regulate these very much, and as scary as that might sound to you people, well, insurance is regulated by the government, so I'm guaranteed that my stuff's going to get covered. For those of us that are in healthcare, we know that's a joke. I mean, it's almost comical to think that over 50% of all healthcare bankruptcies are from people that were insured. Okay, so don't think this insurance is a big safety net. It's not.
It's not.
It's not at all. In fact, it's just the opposite. Whereas with a health share, they're not regulated by the government, so their pricing is way different. Like Christian or Christian Ministries healthcare is way different than Samaritan Ministries. So we pay $180 a month. The first 5,000 of ours has to be covered by us. But when my son broke his leg in 2020, and he was still living with us, there was a $48,000 bill. I negotiated a price with the hospital. Although, as scary as that might sound, I enjoy doing those things. I enjoy negotiating prices because that's what we do in our day-to-day lives, whether it be when we shop for a hotel, we shop for a car, we shop for healthcare. We should look at pricing. Anyway, I negotiated a discount with them, and they gave me a $9,000 discount, which was 20%. And that whole thing got put to my deductible. So within a week of negotiating that price and getting the final price, I had a $35,000 check in my hand. $37,000 check in my hand to pay the hospital bill. And that worked amazingly. And I got to talk to live people. They were emailing, communication was great, nothing like an insurance experience. So health sharing ministries are awesome. And like Dr. Edgerly says, there's some that are non-faith based. In Christian healthcare, I liked it because they had different tiers. Like, for instance, if I go to see Dr. Edgerly, it's not covered. Doctor's fees aren't covered. Dental fees aren't covered. Eye stuff is not covered. I'm not sure about stuff like cataract surgery, but like glasses and stuff are not covered. Right. I imagine cataract surgery would be. Yeah. And that's what we wanted. We want my son broke his compound fracture of his left tibia. Oh, I had a heart attack or I had cancer, something like that. That's what we want covered. That's the expensive stuff. The common everyday stuff to go see Dr. Edgerly. Dr. Edgerly is not expensive. If the doctor you go to is expensive, get a new doctor. Seriously, because even specialists in this whole free market thing, and Dr. Edgerly can speak on this. My son, when we first had Samaritan Ministries, my other son broke his wrist snowboarding. This is what boys do; they break bones. So I tried to find in our network, yeah, right, and hearts. Oh my gosh. I tried to find a doctor that could do ortho that was cash only. And I worked with Samaritan Ministries at the time. They found me a guy in Tri-City Orthopedics. They had a hand specialist, actually. And I wasn't surprised, but most people are surprised. What did it cost to see a hand specialist? This guy only does surgery on hands. It was $112. At the time, I owned a diesel truck, it was more expensive to get my oil changed on my diesel truck than it was to see a hand surgeon. And they did an x-ray for $59, 6-position x-ray of his wrist. And guess what? The surgeon didn't charge me for reading the x-ray. What a concept, right? Yeah. So anyway, this is just some stories of how affordable healthcare can be. I want you to go into a story. You have so many of them, but pick one that comes to your mind about how you saved a patient, how it was very rewarding for you, very rewarding for the patient as far as the care they got, the access they got, and the price they got.
Well, that's a hard question. I mean, it's an easy question, but it's a hard one. I remember a few. I had an elderly man who got up in the middle of the night, tripped, and hit his head on the bedpost, and he literally severed 90% of his ear right across from here.
God.
And he comes in holding this ear, and I said, well, let me take a look at it.
So is this in the middle of the night?
In the middle of the night.
Okay.
Well, no, he waited till 8 o'clock. I appreciate it.
I mean, what a guy, though.
Yeah.
You know, I mean.
And he literally had severed half of his ear off. It was hanging on by a thread. And I just spent a couple hours, maybe I can't remember, an hour or so, and just meticulously put that back together.
No way.
Now, I probably wouldn't have done that on a 12-year-old girl who's going to be Miss America someday.
Yeah, right. Yeah.
But on this old codger, and it looked excellent because, of course, we have a Lord that makes, I get credit for things that all I did is put it back together.
Yeah.
And the healing process, you
God
couldn't
healed
even
it.
find that he had cut it after a while, And that, can you imagine what that would have cost? They would have, first of all, had a surgeon come in and do it.
He would have gone to the ER.
Yeah.
They would have referred him to some kind of surgeon, plastic surgeon,
Probably plastic surgeon.
My guess is I don't know what kind of tests they would have done. With that is kind of hard.
You got to always do the CBC and
what about no imaging?
Oh, they probably would have imaging.
So
make sure he didn't have a head CT.
I mean, I could literally see that costing $10,000.
Yeah.
I mean, crazy.
Yeah.
And the guy was super happy.
Super happy. He was in and out in an hour and a half, that type of thing.
What
I had fun.
Yeah, right. I mean, you got to use your skills as a doctor. I mean, unfortunately, and we could talk about this forever, but most family practice doctors most family practice doctors have been relegated to being just referral sources.
Sadly.
You got an ear problem. We need to, you got an ear cut. We need to refer you to so-and-so surgeon.
Yeah.
Okay. You have a broken bone. We need to refer you to ortho. Okay. When back in the old, you can just cast it, right?
Yeah.
Do you cast?
Well, I used to do a lot of casting. Now I do splinting because the splints that they make nowadays are as good as a cast.
Yeah.
Plus you can take it off occasionally and scratch it,
Yeah,
instead of using the old hanger to go down and do that. Yeah. So that's true.
But that's what's cool is that you get to use your skills as a doctor.
Yeah.
I mean, how many family practice doctors in today's age in a big clinic have sewn up a guy's ear?
Yeah.
I would say almost 0%.
Yeah. Well, I also do injections, which I didn't know they didn't surprise me because I've been at this for 30 years. But I had a guy who trained in orthopedics as a PA, and he joined our practice. And guy had an electron bursitis. That's a burst that's at the end of your elbow, and they get swelled up for every once in a while, like an alcoholic who's drinking all day, or you just bump it and it swells up. I've always drained those. It takes 5 minutes to numb the skin, put a bigger needle through that, drain the fluid off to find out, is it pus or is it blood? And if it's blood, you don't have to worry about it. You wrap it up, they go home, they're healed. And he could not believe that I did that. The orthopedics he was with never did those. And I thought, man, I've done this 30 years, or shoulder injections or elbow injections and carpal tunnel. So many people go to a hand surgeon for carpal tunnel. You can just inject the carpal tunnel with a little steroid and a little lidocaine. It's not that painful. And you've saved them a hand surgeon. You've saved them physical therapy. You've saved them, in a cast or splint for 6 weeks.
Right.
And I'm not trying to be, cavalier about it. I'm not going to do anything that's at risk, but I'll bet I've saved 150 people from palm surgery.
Yeah.
And it's included in membership, except for they have to pay for the steroid.
Yeah.
Which is usually like $13.
13 bucks.
Yeah.
Right. Well, that's one of the reasons we wanted to have you on the show today, is just to show people how accessible and how affordable healthcare can be. And our goal of this podcast is to educate and empower individuals to take charge of their own health.
Yeah.
And this is one way. I mean, you don't want an employer dictating your health. You definitely don't want the government dictating your health care.
Yeah.
So, search the free market, find direct primary care doctors like Dr. Edgerly in your area that are very, very affordable and very, very accessible.
Yeah. As you said, I was one of the first. And now we have 3 in Yakima, I think. Solo practices.
Yeah.
They're not as advanced as mine. But they're doing direct primary care. And I tell students, if you want to do family medicine, do it rural.
Yeah.
Because you're right. If you're in the city, you're not going to be able to do anything.
Yeah.
But except for refer.
Well, and that's one of the things that I love, in our travels across the country, when people say, well, maybe a cash medicine practice will work in Beverly Hills, but it's not going to work in my little town. I'm like, oh, I don't know. I know a guy in small Yakima, Washington, that has a very successful practice.
Very successful.
Yeah. And I think in some ways, rural communities are even better for that, because in rural communities, we're used to not having access to things. So when we can get access, it's incredible.
And I tell specialists also, it can work for specialists. You just have to think out of the box. So at least if you're a specialist, well, like Dr. Bone, she's a specialist.
ENT.
Yeah, you can just charge cash. You don't have to take the insurance. And even if you do take insurance, have a cash-based practice, because if you charge $300, you send that through insurance, you only get paid $100 anyway.
Yeah.
Well, why not have a cash base for $150, where you're not dealing with insurances, you're not begging them to give you approval to do anything. You just take $150. The patient saves money, you save money and work. Very, very simple.
And as a consumer of healthcare, when I am electing anything for me or my family and electively doing anything, I will go to a doctor, and if they will not give me, if their price is all in one and they will not give me a cash discount, which the cash discount should usually be at least 50%, I'll go somewhere else. And I'm not doing that. I'm not saying that to be rude, and I'm not saying that I don't believe in their skills, because I do, and I don't mind paying them. But I also know that the insurance price should not be the same as the cash price.
Right. And the people that we use in our network, again, those are for services that I don't do personally. They all have that. They all have a cash-based system.
Yeah.
And that's why we use them. Now, how does that work? There's a couple surgery centers even. Those are doctors that are surgeons, general surgeons, or orthopedic surgeons, or ear, nose, and throat surgeons, etc. And they have practices just like mine. They don't take insurance. They don't do Medicare. They don't do Medicaid. And they have their cash prices. If I can mention 2 of them.
Please, absolutely.
One is the Surgery Center of Oklahoma. You can go on their site and say, my doctor says I need my gallbladder taken out. That's a cholecystectomy. And you can look that up, and they will give you the price. I had a patient that needed...
All-inclusive, by the way.
All-inclusive, yeah. Includes anesthesiology, pre-op, post-op, etc. You have to fly to Oklahoma, but that's okay. You're going to save so much money. You're going to happily buy that airplane ticket. For an example, and I don't have theirs right off the top of my head, but I had a guy that needed his gallbladder taken out. In town, it was going to be about $27,000. At Oklahoma Surgery Center, it was $5,200.
Yep. And
something like that.
Yeah.
Maybe less.
My son's broken tibia that needed a plate, $48,000 at our local hospital. Surgery Center of Oklahoma, $8,200, all inclusive.
Yeah.
No surprises. I will tell you, it's worth the plane trip. If I need an elective surgery, that's where I would go. But I think Dr. Edgerly is going to talk about Varitas surgery also, which is in Moscow, Idaho, following the model of the Surgery Center of Oklahoma. Let's talk about them.
Right. Varitas is a new surgical group in Moscow, Idaho. That's 3.5 hours from my office. And I have patients that go there as well. They have a great service. I think the cholecystectomy I told you earlier that was done yesterday, I think was 37 or 24 or something like that. Yeah. Significantly reduced.
Yeah. Usually in those surgery centers, or just price in general when it comes to labs and and imaging, usually it's about 8-1. So if the cash MRI is $5,000 or $500, then the insurance one would be $4,000. It's about 8-1, and the surgery is about the same. Think about my son's 8,000 versus 4,800 or 48,000. Kind of getting close to that. So as we wrap this podcast up, Dr. Edgerly, I want to thank you for being on. And also, if anybody wants to meet Dr. Edgerly in person, come to Medical Freedom Northwest. He is one of the hosts along with me and Janet and Carl Lambert. And we will be having a Medical Freedom Northwest conference to talk about medical freedom, obviously, in Spokane, May 3rd. Go to our website, mlrx.com, to find out more about getting tickets. But if you go to the VIP event afterwards, you can hang out with Dr. Edgerly and hear some of these amazing stories. He's got stories after stories after stories. In fact, he wrote a book about his little stories. So tell us about your little book that you wrote.
I wrote it 11 years ago, I think, something like that, maybe longer now. It's called A Spoonful of Laughter Helps the Medicine Stay Down. A spoonful of laughter helps the medicine stay down, or something like that. A
great little book with short little stories about his history of taking care of patients over the last 30 years. And there's some, if you know Dr. Edgerly, you know he has a sense of humor. And there's a lot of good stories in there about that. So we're going to wind this podcast up. If you have any questions, please reach out to Dr. Edgerly at assurancehealth.org in Yakima. And thank you for listening. Thank you for tuning in today. Thank you, Dr. Edgerly, for being on our show.
You're welcome.
Always a pleasure to hang out with you. Follow us, our podcast, comment, let us know what you'd like to see. We do stream live on Facebook, on LinkedIn, on YouTube, on X, and Rumble. Our regularly scheduled podcast is Monday.
I wanted to say one more thing.
Our regular scheduled podcast is Monday, 12:30 to 1:30. I'm not sure what the topic is. Actually, I don't know what the topic is, but you want to tune in, that's for sure. Dr. Edgerly, go.
Let me just make one appeal to you providers out there, physicians, PAs, nurse practitioners. You as well need to get out of the system.
Yep.
It's we can pay you just as much as you can get paid now. You're never going to be there after 5. You're never going to go in on your day off to do dictation. It's just I see 20 a day now at the most, and I make more money than I ever made seeing 40 a day. And I am always home by 5:10, and I never go in on the day off except for maybe to sew somebody up, etc. But I'm not. When my day is off, it's off. And the lifestyle change, getting out of the system, is significantly rewarding.
It's liberating.
It's very liberating.
And I will tell you that, we're in that place too. And I think Dr. Edgerly, I can speak for him. There is not enough money that you could pay me to go back to an insurance-based system. Exactly I would not be a slave. I literally mean this. I say it publicly. $10 million a year would not do it for me. I am so liberated and so happy where I'm at now that there is not a dollar amount that could do it. Be liberated from the system. Don't think that you can lobby the government enough to change the system. You're not going to change it. You don't have to change it. There's already a parallel system out there. We just talked about it. Go do that. Your patients will be happier. You'll be happier. It's really hard. The only way to change the system is to get out of the system.
That's exactly right.
And we have to do that as healthcare providers and educate our patients about that. So thank you all for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you. And then it turned into posting.